We're making progress. The increase in suspected overdoses this year is very concerning. That's why I'm glad you're shining a light on it. It's important that we do.
And the numbers are frightening. Between 2020 and 2024, 796 Montanans died from unintentional overdoses. 345, or 43% of those, were because of fentanyl. In Butte, 21 died in that time period, making Silver Bow County the highest death rate per population in all of Montana.
We've partnered with Butte Silver Bow. I did an emergency declaration back in 2022 along with JP Gallagher and the team there, really trying to emphasize that one pill can kill. That's the message we're trying to get out.
That year there were 10 deaths in Butte from fentanyl. 2023 saw that fall to 5, and then there were no fentanyl deaths in 2024. However, 136 people in the state lost their lives to unintentional overdoses last year. So the work continues.
Addiction, overdose, and behavioral health are really two sides of the same coin. This is why we appropriated $300 million for behavioral health in the state. We're working on building additional facilities, upgrading the facilities we have.
In 2021, Governor Gianforte also spearheaded the HEART Initiative, or Healing and Ending Addiction Through Recovery and Treatment.
Is funded with revenue from marijuana. I felt if we're going to hand out a Schedule I drug, we might as well use the revenues to pay for addiction recovery. So that was a commitment we made in 2021. I think it's now $45 million a year that's available to communities and grants to nonprofits that are doing work in addiction recovery. And
the governor says coupling that with recent legislation allowing Medicaid to pick up some of the costs, 1,500 Montanans have received addiction treatment this year. And as of last week, HEART funds being used to help those who are incarcerated receive behavioral health care 30 days before release in an effort to bridge the gap between correctional and community-based care. In Butte, Chet Lehman, MTN News.